Getting ready. You are now ready to look after your own feeding. The nurse will help you learn how to feed yourself using your feeding tube. If you have any questions or worries, please tell your nurse. We want to help you feel your best and learn how to care for yourself. At the hospital, you will have a feeding tube inserted into your stomach. Here is another example of a feeding tube. In order to begin your feeding, you will have to collect these items first. Here they are one by one. There are a variety of feedings and formulas. Here are some examples. The feed or formula should be stored at room temperature. The feeding bag with tubing consists of a plastic bag, a drip chamber, a roller clamp, and tubing with a tip. You will also need a 60 milliliter catheter-type syringe, a glass of room temperature water for flushing the feeding tube. You will also need an IV pole or something to hang the bag from. Some ideas include a coat stand, a hook in the wall or ceiling, a clothes hanger over a door, or a laundry hook over a door. A gizmo clamp is next. And finally, a clean paper towel. Now you have everything to begin your feeding. Once you have these items together, be sure to wash your hands well with perfume-free soap. And remember when you dry your hands to make sure that you are using a clean towel and you are working on a very clean surface. Shake the can of feeding formula and open it. Now take your feeding bag and make sure the roller clamp on the feeding bag is closed. All in one hand, hold the bag and the end of the tube in a vertical upright position. Open the top of the feeding bag and pour the formula in. Close the lid of the feeding bag. Now, hang the bag so that it is secure and above the level of your shoulder when you are seated. You must squeeze and release the drip chamber until it is half full with the feeding formula. Remove the cap of the feeding bag tubing and place the end into the now empty formula can. Slowly open the roller clamp. And let the formula run through the tube to get rid of any extra air. Close the clamp again when the liquid reaches the end of the tube and put the cap back on the end of the feeding bag tubing. Now you are ready to begin your feeding by pre-flushing the feeding tube with water. You begin each feeding by checking that your feeding tube is working well and is not blocked. Flushing the feeding tube with water is the first step. First, fill a cup with water. Remove the cap of the syringe and place the tip below the water line to make sure no air goes into the syringe. Fill the syringe with 60 milliliters of room temperature water. Put the tip of the syringe into the air and squeeze some of the water out of the tip so that there is no air left in the syringe. Now, clamp the feeding tube with the gizmo clamp. Don't worry, the gizmo should not cut the tubing. Another way to close the flow in the tube is the kinking method, demonstrated here. Next, remove the cap of your feeding tube and the cap of the syringe. Insert the tip of the syringe filled with water in the end of your feeding tube. Now, remove the gizmo, which will unclamp the tubing, and flush your feeding tube with the water in the syringe. Next, clamp your tube again with the gizmo. Remove the syringe and place the cap back on both the feeding tube and the syringe. Now that you've flushed the feeding tube successfully with water, you are ready to begin the feeding. Remove the cap of the feeding bag tubing as well as the cap of your own feeding tube. Insert the tip of the feeding bag tubing into your feeding tube. Now, unclamp the gizmo on your tube. Adjust the roller clamp so the feeding formula drips at whatever rate you were told by your nurse or dietitian. Moving the roller clamp up will make the drip faster. Moving the roller clamp down will make the formula drip slower. You can sit in a chair or sit up in bed for the feeding. Make yourself comfortable, but do not lie down. As long as the drip chamber is above your shoulders, you can participate in non-strenuous activities. After the feeding. Once the feeding bag is empty, it is time to disconnect the feeding bag tubing and flush your feeding tube and tubing with water. First, be sure to close the roller clamp on the feeding bag tubing. Clamp your feeding tube with the gizmo. Pull out the tip of the feeding bag tubing and replace the caps on both your feeding tube and the feeding bag tubing. Now, refill the syringe with 60 milliliters of water. Repeat the action of putting the tip of the syringe into the air and squeezing some of the water out of the tip. Open the cap of your feeding tube and insert the tip of the syringe into the feeding tube. Unclamp the gizmo and gently flush the tube with the water to get extra formula out. Then reclamp the gizmo and remove the syringe. Remove the gizmo and recap the syringe. After each feeding, the feeding bag needs to be flushed with water so that no formula is left in the tubing. To do this, take the bag down, open the top, and pour 1 cup of water into the bag. Remove the tip cover and open the roller clamp so that water runs through. You may need to squeeze the drip chamber and hold the bag of water over your head to get this started. Be sure to hold the tip of the feeding bag tubing over the sink. Repeat this flushing if there is still formula in the feeding bag tubing. You will receive a new feeding bag each day while you are in the hospital. At home, 1 feeding bag can be used for up to 7 days. Now that you have seen the steps to follow, you have the right information to do your own feedings. Feel free to watch this video a few times, and if you still have questions, please ask your nurse.